that is the natural remission. That means in this prashama avastha, definitely the doshas without any further indulgence in the the mithyahara vihara etc., there will be a natural remission or return to the normalcy, homeostasis of the doshas, and free from the disease you can see. Okay. So now this importance is the Prakopa, second stage of the disease process. And so here the chance to initiate the treatment. So here we have to initiate the treatment, and left untreated, it will go to the next stage. Okay. So eva prakupita doshaha samuttana visheshatah sthanantarani cha prapya vikaran kurute pahur. So here if it is untreated, spread to various locations, undergo sthana samshraya. So there, that's why we have to give more importance to this particular prakopavastha. Okay. So next coming to the prasaravastha. So this is the third stage, that is the prasaravastha, where the stage of the spreading or the further progression of the prakupita doshas is called as the prasaravastha. Okay. So here what happens, the spread of the doshas from their own side to other areas is called as the prasaravastha. So here what happens means, here the doshas which are accumulated and aggravated in the chayavastha as well as in the prakopavastha. In the chayavastha, the doshas got accumulated. In the prakopavasthas, the doshas aggravated if not treated. In the presence of the further etiological factors, the doshas spill out from their own side and then spread throughout the body. So this is called as the prasaravastha. So that is why he is telling tesham ebihi atanka visheshaihi prakupitanam kinva udaka pishta samavaya iva udriktanam prasaro bhavati. With the continued nidana, as I told you now, the dosha undergo further vitiation and prasara stage, that is the prasara stage, where they start moving to the other places. The spillage of the dosha will be there, or overflow of a mixture of kinva or a yeast, udaka or water, or pishta or the flour because of the fermentation. So this is what he is telling here. So actually what happens in the chaya and prakopa avastha, these are limited to their own sides, right? That is in the koshta itself. But in the presence of continuous etiological factors like the vyayama, ushna, tikshna ahara, or ahita ahara, and because of the chala guna of vata. When I tell these things, you may be remembering one thing, that is the koshtas. Because of, from the koshtas, the doshas are now moving towards the shakha. That means the shakhadi gamana of the dosha starts now in this prasaravastha. Okay. That's why it is very clearly mentioned that the quotation Shakadi Gamana, you may be remembering, that is Vyayamat Ushmanat Taikshnyat Hitasya Anavacharnat Koshtat Shaka Malayanti Drutatvat Marutasya Cha. So that means in the further indulgence of the Nidhana, like Vyayama, Ushmana, Tikshna, intake of food, or even Hitasya Anavacharnat, like the practice of Mityahara Vihara. Koshtat Shakha Malayanti, from the Koshta, the actually from its own residence, the Koshta, it will leave its own place and it will go to the Shaka, Dhrutatvat Marutaticha, because of the, here the culprit is Vata. Okay. So because of that, it will enter into the Shaka like Rasa, Rakta, Mamsa, Medha, Asti, Majja, Shukra, etc. So Samastaha, Shonita Sahitaha Prasaranti. So how it will go means, along with the other doshas like even Rakta also. Okay. So here he is telling, so why it means, once again, I just wanted to tell you, Vayu Gatimatvat Prasarana Hetu Sahi Rajo Bhuhishtaha. That's what I told you, because of Dhrutatvat Marutasya. So here Vata is the prime factor in the process of Prasara movement, Prasara or the movement, as it is having Chalaguna. Vata is Rajo Guna Pradhana and Rajas is Pravartaka or initiator of for all. Okay. And how it occurs. So here he tells very clearly once again, Yata Mahan Udaka Sanchayo Ativruddhaha Setum Avadharya Aparena Udakena Vyamishraha Sarvataha Pradhavati Esham Doshaha Kadachit Ekasho Dvishaha Samastaha Shonita Sahitava Anekadha Prasaranti. So now very clearly he is mentioning how a particular water flow, which will be along, which will with the accumulated excessive water, for example the flood in the rainy season, isn't it? a very small, the a nadi which is flowing normally with the Varsha Rutu, what happens? Because of the excessive waterfall like this. So isn't it? So it will setum avadharya. It will just break the setu or the bridge, and it will flow, flow heavily, isn't it? So this is what happens in the case of the dosha, also in the case of prakopa to prasara. So the prakopita doshas, because of the excessive accumulation or the excessive quantitative and qualitative accumulation, what happens? It will just come out, or the vimarga gamana happens here. So it will go and it will reach the other sthanas here. Okay, in the form of, it may be in the form of the 15 combinations of doshas here they are mentioning. A single dosha like 4 vata pitta kapha etc. In the combination of two doshas or the dandvaja, like there are 6 such a combinations like vata pitta, vata kapha etc. And the combination of 3 doshas may be also. There are 4 such combinations, vata pitta kapha, vata pitta rakta like. And in the combination maybe along with the vata pitta kapha and rakta, that also may happen. So there are, this particular spreading stage of spreading will have a different combination of doshas. Maximum 15 such combinations may happen. Okay. So what happens here? The doshas, uh, in such condition, whenever it moves from the body here, it will enter into uh, the different areas of the body wherever there is, kavai gunya. So where it will stop and starts the uh, disease manifestation. So he's telling Krishne ardhe avayaveva api yatra ange kupite vrasham dosho vikaram nabasi megavat tatra varshati. During the process of prasara, dosha move to one particular place in the body or to half of the body or to the whole body. Dosha gets settled at those places where there is tushti, that is kavaigunya, leading to the diseases at that particular place. So this settlement happens similar to the Nabasi Megavat Tatra Vashati, the clouds getting accumulated at a particular location in the sky and it rains. So once again, to conclude, aggravated dosha move all over the body and manifest the disease wherever they struck, and that is the whole body, half portion or the entire part of the body also, like the cloud rains in the sky wherever it stops. Okay. So for example, in this particular prasaravastha, it will have its urdhvagati, adhogati or the thiryagati of the doshas will be there. In the urdhvagati, there may be some manifestation of the diseases like chardi or some of the indriya pradoshija or the indriya disorders will be there, shwasa kasa etc. In the adhogati, it may have the adhisvara, shlipada, sandivata etc. And in the thiryagati, maybe sometimes the skin conditions or some of the other manifestations like the hypertension etc. Okay. So the different lakshanas of the prasaravastha, what happens? Evam prakupitanam prasaratam vayur vimarga gamana atopa osha chosha paridaha dhumayanani. That is, vayu will have its vimarga gamana and atopa. The pitta will have osha chosha paridaha dhumayana. Kapha will have its arochaka, avipaka, angasada and chardi. Okay. So these are the different manifestations. So here this particular stage is also called as the what you can call the there will be the still more the dosha sammurchana. Okay, so without, so just before going to the dosha sammurchana, this particular stage of prasara happens, wherein here also there is involvement of dhatus furthermore along with the dosha. Here the dhatus also started getting affected here. Okay, so this is just before the stage of dosha sammurchana. So vata will have its Vimargamana and Atopa stage, and Osha, Chosha, Paridaha, etc. by the Pitta and like Dhumayana, etc. and Kapha having Arochaka, Avipaka and Angasada, Chardi, etc. So just for your understanding, what is the difference between a Prakopa and Prasara? So you can see the figure here. After heating ghee, it melts and it is the Prakopa. Just started melting now. That is the Prakopa stage. So before that, you will keep the ghee piece in the, or the solidified ghee in the pan. So that is just it is fit to the pan itself. Now once you start heating, what happens? It's slowly starting now melting. Okay. So now still it is in the same pan itself. Okay. So but further heating of this particular ghee will start now boiling and it will come out. So this is what how the Sanchaya, Prakopa and Prasara you can understand here. Okay. The same thing also will happens in our body with the further indulgence of the Ahara Vihara, especially the Mithya Ahara Vihara, leads to the vitiation of the doshas, and the doshas will leave their place from their own sthana and it will go move, further spread all over the body. Wherever it see the Kavai Gunya or weakness, there it will go and settle and manifest the disease. Okay, so that is what I told you previously. That means here in this particular stage, the doshas with the further etiological factors enters into the shaka gamana of the doshas. Okay, so vyayama dushmana taishnya hitasya anavacharana koshtat shaka malayanti. So in this particular stage, what you have to do, what is your importance here? When the patient comes with a different signs and symptoms, you have to understand now it is not the avastha of chaya, it is not prakopa, now it is the prasara avastha. That means it is entered into the third kriya kala, right? So what is now the doshas are not in the koshta. This is very important. Now you have to understand the doshas are now in the shaka, right? So shaka means definitely there will be some of the signs and symptoms you can understand. Okay. So what you have to do, your the thing is now you have to bring back the doshas from the shaka to the koshta. So for that purpose, there is a the quotation says like this: dosha yanti tata tebhyah shrotomukha vishodhanat vidya vishya abhishandanat pakat vayosha nigrahat. Okay, so this is how this is what you have to do in this particular stage. That means, so here your aim is to bring back the doshas from the shaka to the koshta. For that purpose, he is telling dosha yanti tata tebhyah shroto mukha vishodhana. That means you have to do the shroto now because of the aggravated doshas in the prasaravastha. Now all the channels have got blocked. It is already settled in the shaka and now it is unable to come back because of the shroto avarodha. So the first and foremost thing what you have to do is shroto mukha vishodhana. So that's why here it comes. So first what you have to do, vriddhihi vishyandanath pakat koshtam vayoscha nigrahat. So by doing this shrotomukha vishodhana, before that what you have to do is vriddhi of the doshas. By still more you have to increase the dosha by giving no, what you can call the similar quantity of diet or the regimen or whatever needed. Vriddhi here means so pramana atirekaha. So what you have to do, vridya vishyandanat pakat he is telling. Okay, so you have to do the vriddhi of the doshas. That means you have to, for example, pitta means you have to still feed with still more katu ushna ahara vihara so that the vriddhi of the doshas will happen. Then Vishyandana, then there is a Dravi Bhavaha. Okay, Vishyandana means here Dravi Bhavaha. Okay, first you have to increase the doshas, then you have to eliminate it. So Dravatva here, once you increase the Vriddhi or the quantitative increase of the doshas, then you have to give some of the heat. So for this, I can tell you, before giving the Shodhana treatment, we will make the vriddhi of the doshas by giving the snehapana, right? With the snehapana, there will be dosha utklesha will be there, right? And even, for example, I can tell you, there was a patient of Vicharsika admitted just a day before yesterday in the ward. Okay, so what happens there? The patient was having this problem since many years, and he was having, in particular, in the lower limbs, he was having the problem. So once he got admitted in the hospital, why I started with the Snehapana. So by giving Snehapana with the second, third day now today, second day itself he started getting the eruptions even in the other parts of the body also. Now what we have to tell the patient? So patient now he will be in a confusion, isn't it? So I was having only little, like in the only in the lower parts of my body, I was having some of the lesions. Now in the whole body it is coming. So it is a good, not a good treatment. Like so, this is what common a layman will be understanding. Now, what is your part? You know that you are doing the dosha utklesha. So you have to tell the patient. So even prior only, if you tell, that is well and good, so that they will be convinced. So that means when you do the dosha utklesha, whatever is there inside, it will come out, isn't it? So exactly that is what happened with the 2 days of Slehapana. Okay. Now you are doing the dosha utklesha, and after the dosha utklesha, what you will do? You will go for the external abhyanga and the svedana. That means you are doing the Vishyantana or the Dravi Bhava of the doshas. So it will, whatever the adhered doshas or the which is in the adhered to the cells deep in the dhatus, it will be taken away with the, or it will be the mrudukarana will be done by the snehana, and with your svetana you will be doing the vishyandana or the liquefaction of the dosha, so that it is easy to come to the koshta, isn't it? So that is what happens here. Vriddhi, first increase the doshas, and then coming to the liquefaction of the doshas, then shrotomukha vishodhana, shrotas. Now with the with the svedana, the shrotomukha vishodhana will happen. And one more thing important is vata nigraha. This is because of, as a culprit, the vata is only the cause for the shaka gamana. Now here also you have to take care of vata at the same time, because you are giving the ghee here or the taila here, vata shamana will be there, and there will be dosha vriddhi, dosha utklesha you are doing, and shrotomukha vishodhana with your svedana effect. So all these things, vata will be in the control, and you are taking the, or bringing back the doshas, vitiated doshas from the its normalcy and to the koshta. So this is what happens in the case of this is what your part in the prasaravastha. Okay, hope I am clear here. Okay, and coming to the fourth stage, that is stana samshaya avastha. Uh, what happens here? This is the fourth stage, wherein the doshas which are in the prasaravastha, if not treated, take the sthana samshraya. So the sthana samshraya may be due to the sangha or obstruction, or it is because of the kavaigunya or the abnormality in the shrotas. So what happens here? The doshas, when once gets sthana samshraya, vitiate one or a group of doshas, that is dhatus or malas. Once again, I repeat, whenever the sthana samshaya happens, there may be chances of sangha, obstruction, or the kavaigunya, abnormality of the shrotas. Okay, so wherever the abnormality is there, the doshas will go and lodge and manifest the disease, isn't it? So once the doshas gets the sthana samshraya, it may vitiate one or a group of doshas, dhatus or malas. So this vitiation of the doshas is called as the dosha samorchana. That is what I told. That's what I told previously. The prasaravastha is the stage just before the dosha samorchana. So the actual the disease or the samprapti starts here in this particular condition. That is the dosha samorchana. So what happens here? When once the dosha samorchana take place, different pathological conditions are created in accordance to the involved dosha and sthana. Okay, so whenever the dosha starts getting or lodges in the udara pradesha, there may be dosha samorchana in the udara. There may be like gulma, agni vikara, vibandha, anaha, visuchika, etc. Okay, so whenever it is in the basti, there may be prameha, mutraghata, ashmari, etc. Whenever it is in the guda, like the bhagandhara, arsha. So that means the sthana is very important. The involved doshas and the doshas are very much important in production of the different types of vyadhi. Okay. So this particular stage is that is the fourth kriya kala. It is also called as the stage of purva rupavastha. That means the actual disease starts manifest here. Some of the prodromal symptoms or the purva rupa you can see here. Okay. So the intensity of these purva rupas depends upon the severity of the doshik vitiation. Okay. If the dosha vitiation is so strong, then you can see the intensity of the purva rupa is very strong also. And that means the if the vitiating doshas are very strong, then the clear cut prodromal symptoms may be observed. Or if the vitiated doshas are weak, then the mild symptoms may be observed. Okay, so the intensity of prodromal symptoms helps in the assessment of the severity of the disease. Okay. For example, you may be knowing even the Pururupa is also, there are two type like Vishesha Pururupa and Samanya Pururupa. For example, in case of Jwara also we know that there are Shrama, Arati, Vivaranatva, etc. as a Samanya Pururupa, wherein the Vishishta Pururupa, wherever the Jramba is in Vataja Jwara, Nayana Daha in Pittaja Jwara, Aruchi in Kafaja Jwara, etc. So that means this particular stage will give you a very, very important clue. What type of clue means that is one type, which type of disease is going to happen and what is the predominance of dosha here. Okay. So the signs and symptoms of the disease will give you a clue of the dosha as well, or the mala involvement, and the particular type of symptoms will also give you a clue of which particular dosha is having predominant here. Okay. So coming to this sthana samshaya avastha, he is telling chaturtha kriyakala iti chaturtha chikitsavasarah chikitsa cha atra doshasya doshatya chet upayasya. So this is very important. The Dalhana very clearly chikitsa cha atra doshasya doshatya cheti upayashritaha. So here not only for the doshas but also for the doshas also, both dosha dosha, both you have to give the treatment in this condition. Okay. So he is telling evam prakupitanam tanschan sharira pradeshan agamya tamstan vyadin janayanti. So now the localization of the what you can call the doshas will spread all over the body. Wherever the kavaigunya is there they get accumulated and produce the disease. Okay. So as we know, kupitanam hi doshanam sharire paridhavatam yatra sangha kavagunyat vyadis tatropajayate. The same quotation whatever I have explained previously. And sthana samshrainaha krudhva bhavi vyadi pratibodhakameva doshaha kurvanti yallingam pururupu taduchyate. So this particular condition or the stage of kriyakala will tell you the bhavi vyadhi or the future, what is the disease which is going to manifest. Okay. So this is very important stage. At least in this particular stage, you understand that this particular disease we can stop. For example, as I told you, the giving the example of Vicharchika, isn't it? So because this is the season for aggravation of the skin diseases. Okay. So in this, the environment also is same. The person is also Vata Prakriti. Kapha Prakriti, and the indulgence in the same Ahara Vihara, because the person was a contractor, he goes outside, takes outside food continuously, outside environment with the exposure to the sunlight, as well as the different uh, the environmental raja, or the different exposure to the chemicals and the other things. So that is what happens to that particular person. Okay, so that means now we have to understand in this particular stage we have to go for certain type of treatment. So here the treatment is very much essential, because dosha as well as dosha both are having its main affection here. Okay. And next is the Vyakta Kriya Kala, wherein this is the Doshas Dushya Samurchana stage. If not treated in this particular Pura Rupa Avastha, in the presence of further etiological factors, the doshas become stronger and stronger and manifest the disease and manifest in its full form, or fully blown disease will be manifested. This is the fifth Kriya Kala, which is also called as the Vyaktavastha or the Rupavastha. Here the fully blown disease, you can see manifestation of the disease takes place in its complete form. Okay. So Panchama Kriya Kala, Atha Urdhvam Vyadesh Darshanam. So here Vyadir Darshana, complete or the fully blown Rupa or the symptoms of disease you can see here. Okay. So in this Kriya Kala, so what you can see is like a Shofa, Arbuda, Granthi, Vidrudi, Visarpa, Adina, Pravyakta Lakshanata, Jvara Atisana Pravritinam Cha. So there is the different form of diseases have mentioned here, the Shofa, Arbuda, Granthi, Vidrudi, Visarpa, etc. Okay. So this will have it, because here the person also not stopped indulging in the Mityahara Vihara, and it was not treated properly. So it has attained the Vyaktavastha or the Rupavastha or the complete disease manifestation. And next is the Veda Kriya Kala, the sixth stage of Kriya Kala. Okay. So in this Kriya Kala, the inflammatory or the will be the there will be means the rupture of the disease or what you can the this particular Kriya Kala wherein we are not at all treated. So in further indulgence of the doshas, it is not now in our hand, isn't it? So this is the complication stage or the chronicity of the doshas or development of complication will happen here. For example, the Jwara will become the Jirna Jwara here. The Jwara in the Tarana Jwara itself or the stage itself, we have to treat it. That means within 7 days, somehow with the Patya Ahara or Patya Vihara or with the treatment or some of the intervention, we have to treat the Jwara within 7 days. Once it exceeds 10 days means it will become Jirna Jwara. In that particular condition, it is difficult to treat, isn't it? Similarly, ulceration to vidhrati. So, for example, why ulceration specifically mentioned here means, so this particular Kriya Kala has been mentioned by Shushruta in the Vrana Prashna Adhyaya. So, how a small Vrana, because of the vitiation of the doshas, may be Nija or Agantu, how it will be blown into a complete ulcer form, okay, or in a complicated manner. That is why in this particular Vrana Prashna Adhyaya itself, Shishruta has mentioned this particular Kriya Kala. Okay, Ata Urdhvam Etesham Avadirnanam Vranabhavanam Apannanam Shashtaha Kriya Kalaha Jwara Atisara Pravruti Dinam Cha Dirghakala Anubandha Tatra Pratikriyamano Asadhyatamam Upayanti. So here in this is a complicated stage, isn't it? So what happens in this particular stage? See the Vrana over there. It's a maybe a diabetic foot, isn't it? So here what happens? You have to cut the organ there itself, or other maybe an ankle amputation may be needed. Otherwise, you may have to leave the whole limb, isn't it? So that is what the complication we tell. So that means the particular affected part will be completely under the influence of the disease. So in that, but this is the complicative stage. Okay, so so completed the fourth, sixth here. I think hope I'm clear or I have not made you more complicated. Doctors, anybody is there? Anybody is there? Is it clear or you have any doubt here before moving to the next slides? Is it clear? Anybody? Are you there or sleeping? Or taking food? Anybody can give me a hint? Are you there? Any students? Any doubt? Am I audible?
Yes, ma'am.
Okay, okay. Thank you very much. I don't know who are the students here. Anyway, thank you for the patient listening with me. So coming to this Kala. So just listen carefully. Uh, the treatment is easier if the disease is diagnosed in the earlier stages. That is what I was telling all this in my presentation. When the doshas are controlled in the Sanchaya stage of Kriya Kala, they cannot proceed further into the consequent stage of Kriya Kalas. However, if the doshas are ignored, they will proceed further, will be more strong and deep rooted, and there will be resistance. 6 stages of action. Okay, and it have the correlation with Panchanidana like Sanchaya, Prakopa, Prasara with its Hetu stage, Sthana Samshraya, and with the Purarupa, Vyakti, and Veda, and with the Rupa and Upashaya and all the 6 Kriyakala Samprapti. Okay, and it gives an idea about the Sadhya, Asadhya, or prognosis of the disease. And Kriyakala also helps to find out the appropriate time for doing surgery or Shastra Sadhya disease, etc. Okay, and timely intervention with the appropriate Aushadha, Pathya, Vyayama for the same will be helpful whenever we understand this particular Kriya Kala. Okay, so both the short term and long term complications can be effectively managed in the and prevented by breaking the various pathological stages in this particular condition when we understand it properly. And just I wanted to tell you the concept of Kriya Kala in one or two diseases. So the concept of Shat Kriya Kala is applicable for almost all the disorders, including the diabetes or rheumatoid arthritis and even leprosy, etc. However, it is used in the diagnosis and treatment of cancer also in its early stage, because cancer is one such a disease wherein uh, we uh, we diagnose or even the patient come to know in the end stage any other thing, because previously even the diabetes also was like that, but nowadays there is so many other measures to understand or to diagnose, isn't it? Various different types of laboratory measures are there to understand the different stages. But in case of cancer, it will take a long run to have its full blown symptoms to show. By the time it will have its complete spread all over the body. That is a tragedy in cancer. Okay, but whenever we know this particular Kriya Kala, can we do something in this particular aspect? So, for that purpose, this is a very important point wherein in the modern medical science also the diagnosis of cancer is only possible at the stage of manifestation or the stage of complication, resulting in the challenging treatments like chemotherapy, radiotherapy, or the other surgery, etc. But in case of cancer, in Ayurveda, whether can we understand this particular understanding the Shatkriya Kala, so which may lead to more effective and less complex lines of treatment. So the various phases we can understand like this. So imbalance in Tridosha, that means the Vata Pitta Kapha can be correlated with the imbalance in the ratio of the oxidant and the antioxidant molecules or the radicals in the cells. So the first stage of Shatkriya Kala, called Sanchaya, may be represent the level of oxidative stress which damages the cell structure and its functions. Such phenomena may induce somatic mutations and neoplastic transformation in the cells. So this is in the baseline. So the basic thing is like no, that means each and every cell is very important. So with the baseline cell, the changes happens here. So the sanchaya starts. That means because of the oxidative stress. Okay. So for example, I'll tell you, whenever we are under stress, our whole body will become the acidic media. Actually, to have a very good health, we our body we also always we should maintain a alkaline media. Okay, in an alkaline media, the especially the cancer cells like the giant cells will not have its chance to thrive. Okay, that is why always alkaline media we should maintain our body in an alkaline media. So what happens in any conditions of stress, some other the because of the food habits or other environmental factors or some other regimen, etc., what happens, we ourselves will keeping our body into the this particular oxidative stress or the what you can call that the acidic media. Okay, so with this what happens that it damages the cell structure and its function. So such phenomena may induce the somatic mutations and the neoplastic transformations in the cells. Okay, so so this particular thing we have to make the means give we give awareness to the people. So this is possible to prevent the cancer. Okay. And one more thing, by understanding ourselves, we should not be into a stressful situation always. Of course, we are all human beings. We will have our own stress factors, maybe at home or in the society or in the institution or with any other such things, isn't it? So the life will be having so many events. So, but still, one stage we have to understand that the stressful life will always put into a very difficult situation. Okay. So next step is, however, Prakopa stage has unusual cell proliferation due to oxidative stress, which may have increased DNA mutations or induced DNA damage and genome instability. So this is when certainly when they expose to the certain chemical factors or X radiations or some the food habits, etc., will be leading to the mutation of particular cells. Okay, so this also we can make out, because those who are especially working in such areas, we can give some of the clue. Okay, or they have to undergo certain biomarkers or etc., or even with a very small slight symptoms also they should approach the doctors, or even sometimes within us only we have to understand these things. And the stage of prasara can be correlated with the cell migration, as a oxidative stress can augment the tumor growth. So what happens in this particular condition means, once the cell division starts, the excessive proliferation starts, so it will be slowly what happens, it will be within the site usually. Okay, so within the site, then we call it as a primary tumor without having its spread to the other part of the body. So that is, we call it as the primary growth of the tumor, where we call it as, that is the stage 1, wherein it is a purely, we call it as, it is a stage wherein we can treat the cancer. But what happens with the further indulgence or the further proliferation of the cells, slowly it starts its second, third, and fourth stage, wherein now the fourth stage it will moving from its own side to other parts of the body. That is what we call it as the what you can call it as the metastasis stage. Okay, so wherein from, for example, the primary organ may be lung, but from the lungs, when it goes to the liver or to the bone, we call it as, it is now stage 4, or now the particular condition is having its metastasis in the liver or the bone. So this is an incurable stage. So that means, once we understand, or the different type of the stages of cancer, one thing is, we can give awareness to the people. So this is the symptoms when the cancer is there in this particular organ, or when it is and we have to come early to get the treatment, etc. So the physician is very important here, physician's role, wherein he has to find out it in the early stage itself. Okay, otherwise it will have its spread towards the other areas of the body. So due to various other factors, like the doshas in the body undergo vitiation of morbid changes, which initiate the process of disease manifestation. And it is clear from the description that the various changes involved in the disease manifestation process takes place in the distinct steps, as the vague symptomatologies are expressed in the early stages of the disease manifestation procedure. It is necessary for the individual that he or she should aware of the changes occurring in the body. So a good knowledge of concept of Kriya Kala is very essential for early recognition of the disease procedure. So why this is important means, not only the physician, as a Ayurveda faculty or a learned person of Ayurveda, the each and every the stage of the disease, or the a very minute change in the body will be bring to the notice of the physician. That is more important. Such a awareness to be given to the patient. Okay. So if the deranged doshas are left unrecognized and untreated, they will gain the strength for their further development, and the disease manifested in a particular stage of Kriya Kala may even precipitate some other diseases in the name of Nidanarthakara Rogas, or which is left, if it is left untreated or ignored. Okay. So coming to a particular disease like a Staulya, I just wanted to tell one more important example here. For example, Staulya. So this Staulya you might have seen in the, you can see the figure here. So from the normalcy to the Staulyavastha. Okay. So that the change is a process. It is not an event. That means from the normalcy to attain the Staulyavastha, it is just not an event. It is not happens in one day. So it is just a process taken place since long time. Okay. So we can see here the different, the person will be indulging in different activities like no the divasopana, shleshmakara, ahara viharas, adhyashana, you can see here, isn't it? And the avyayama, sitting in one particular place and doing the things, etc., isn't it? So that means the sedentary lifestyle will be leading to the different pathological stages wherein nidana sevana leading to the kapha sanchaya, and then Anganam, Gaurava, Alasya, everything will slowly start here. Then further indulgence in the Kafakara, Ahara, Vihara, leading to the aggravation of Kapha along with the production of Ama, Annarasa, and then leads to the Kapha Vriddhi. So the next again indulgence in the continuous of indulgence in the Nidana Sevana, leading to the Shleshma Prakopa. Once again, Vriddhi of the Medho Dhatu, Sangha in the Medho Vaha Shrutas, Vata Prakopa and in turn Jataragni, Sandukshana, and you know the Samprapti of this particular Staulya very well. Whenever the person is having, there is actually obstruction to the Amashya will be there. So because of the obstruction, here the Vata Vriddhi will be there. In turn, the Vata Prakopa will leads to the intense Jataragni. Okay, so Jataragni Sandukshana will be there. Once again, the person will be taking more and more food. Ati Bubukshana, in turn, Medo Dhatu Vriddhi will be there. Okay, so what happens in the Sthana Samshaya Avastha of Staulya? So the Dosha Samurchana takes place at this stage. The Kapha Samurchana takes place with the Medo Dhatu, leading to the prodromal symptoms like Guru Gatrata, Swedha, Abhada, then Ahastatva, then Tikshnagni, wherein the patient will be taking more and more food. Okay, so this is the Vyakta Avastha, where you can see all the different conditions, like the patient, he is having exhibiting all the symptoms. So this is the Vyakta Avastha here, wherein the Javoparoda, that means due to the Sharira Shitilata and the Sukumarata, Stula persons are Utsaha Rahita. So they will not be having Javoparoda. They cannot even move, or they will be having the laziness always. Okay, or they cannot even move their body as they want. And Kruchra Vyavayata, even the Shukra Marga Nirodha also, or the Avarana will be there. So even they may not be having a proper Vyavaya also. Then Daurbalya and Daurgandhya, because Daurgandhya, Swedha Bada, both these together because of the excessive sweating, they will be having this particular problem. And Kshudati Matram, excessive hunger, and Pipasa Atiyoga. So excessively, sometimes excessive water they will take, or even sometimes less, but Vayu, the more of the the craving for water and the food will be there. Okay, so this is the Veda Avastha. So where all the different complication stage they will occur. So once there is a obesity or overweight, you know very well what are the different. So there will be manifestations, or they will be into risk, like maybe a cardiovascular risk will be there, isn't it? Or even there may be neuromuscular risks, isn't it? Or even the different diseases like Kushta, Visarpa, Bhagandara, Jwara, Tisara, Prameha, Asha, Shripada, Apachi, Kamala, whatnot. So many different disease manifestations, they will be into risk. So the stage of differentiation of the different diseases will be there, or the Staulya Upadravas. Okay, so everything will be having Adhikata. So even in Ashtanga Hridaya also classifies, there are three types of Staulya: Adhika Staulya, Madhya Staulya, and Hina Staulya. So all these different stages stages will be having their the different complicative stages. So conclusions, as I told previous slides, no. So we should by knowing this or understanding this, the different pathological stages is very, very important to understand the to have a proper intervention where and when required. And coming to the end of the presentation, so a quotation holds good here, which is yatahi alpena yatnena chidyate tarunastaruhu sa eva ati pravruddhastu chidyate ati prayatnataha. That means a tree which is, when it is very small, it is easy to pluck out, but when it has grown very big, it is difficult to cut out and take up from its root, isn't it? So evameva vikaro api tarunaha sadhyate sukham vivruddhaha sadhyate krichra asadhyato vapi jayate. Means whenever any disease condition also, whenever if it is in the very small, for example, the breast cancer, when it is in the early stage, they will just do the surgery. Okay, they will just take out from them and surgery, and it will be left as it is, or sometimes followed by a chemotherapy. But if it is left untreated, the whole breast they have to remove, and then followed by chemotherapy or even radiotherapy, and again there is a chance of the disease to recur, isn't it? So that is why the knowledge of Kriya Kala is very, 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 very important as a physician to consult. Also, it is equally important by the patients or the people, so that any small ailment, they have to consult to the physician. So anything which is recurrently coming also, they should not neglect. So they have to come to the physician. So this awareness is given to the public, that is as a physician or maybe a Ayurveda or any doctor fraternity. It is very important, make the people understand that any small ailment also they should bring to the notice of the physician. Self medication should not be there, and the different diet and the regimen followed in each rutu is also equally important to control all these things. Hope I am clear to you. And it is the end of my presentation. Okay, so any doubt here you can ask.
Thank you, doctor.
Yeah. Any doubt? Any students want to interact here?
Hello.
Hello. Yeah.
Yes, ma'am. Ma'am, I have only one question. Ma'am, in the
Yeah.
first slide, in the very first slide, you mentioned about Rutu Kriyakal and Vyadhi Kriyakal. Ma'am,
Yeah.
is there any difference to that?
Yes,
Or
that's what I told you. Rutu Kriya Kala means it is the natural fluctuation happening to the doshas. Okay. So that's what I told, like, Vata dosha, it will have its natural sanchaya. In the sanchaya, how sanchaya happens also, I told you, right? So a Vata
yes, ma'am.
Prakriti person, when indulgence indulgence in the same ahara vihara, and in the Grishma Rutu, there is a Ushna will be there, isn't it? Actually, Vata Prakriti person, when he indulges in the Vatakara Ahara Vihara, so there will be Prakopa, there should be a Prakopa of the dosha. But what happens there? Because it is a Grishma Rutu, there is Ushna, isn't it? So that is opposite to the Vata, and hence it will be only a Chaya, not a Prakopa. And coming to the next Rutu, what happens? The next Rutu, because of the Shitata, again the Vata Prakopa will happen. Okay. Already Vata Prakriti person, indulgence in the Vatakara Ahara Vihara, and the environment also is a Shita, which is same like Vata only, isn't it? So there will be aggravation of the dosha. So, but what is important here is, in this particular condition, there will be in the Prakopa Avastha we have seen, isn't it? Something like a Koshta Toda or Sabdata, etc., isn't it? In such condition, the person also should understand, or even uh, the natural, further indulgence of the Nidana should be avoided. Otherwise, what will happen? The Vata, by nature, it will have its remission in the next stage. I mean, in the next Rutu, that is in the Sharad Rutu, because in the Sharad Rutu, that is a intense sunlight will be there. So with that sunlight, what happens? It is opposite quality to vata, right? So it will have its natural remission unless and until further continuation of the ahara vihara, the disease will have its natural remissions. That is rutu kriya kala. Understand? So vata will have its complete. That's why I told sanchaya, prakopa, and prashama. That is rutu kriya kala. So before undergoing the prashama, when it enters into the next stage, that is prasara, that is the vyadhi kriya kala. Is it clear? So naturally, vata should undergo its prashama in the sharad rutu. Without undergoing a prashama, it will enter into the prasara in the further indulgence of the ahara vihara. That is called as vyadhi kriya kala. Even in vyadhi kriya kala, we can up to prasara avastha, we can take like the dosha kriya kala. Here up to that, only the doshas are having its involvement. But once you come to the sthana samshraya stage, wherein dosha samurchana happens, there the dhatus also starts its
Hello.
Hello.
There is some network issue, I think.
also having the other
Hello, ma'am. Is it audible?
yeah, audible.
Hello, ma'am, but I can't hear you.
Hello.
Hello.
Yeah. Is it clear or?
Now it's okay. You can continue.
Hello, ma'am.
కొంచెం ఆగి చేయండి.
Am I audible?
Yeah. Tell me.
Ma'am, one more question.
Yeah.
Regarding, ma'am, if someone is of Vata Prakriti and he or she undergoes Satkriya Kala, suppose in the first stage, Sanchaya stage, what will be the intensity of the doses? Like the Vata, in Vata Sanchaya, the symptoms are Stabda Purna Koshtata. So the there will the three prakrutis are there. The effect will be same or different.
Same connection in here. Hello.
Yeah, ma'am. You can continue.
Can you please repeat the question because the connection was not proper?
Oh, yeah. He has already left here.
Hello. Yeah.
Hello.
Yeah. Tell me. What was the question?
Actually, I am also not here currently.
Because
Yeah.
there was a connection problem
Vibhuti,
here.
did you hear? Vibhuti, can you hear me?
Yes, ma'am. Now I can hear you. I think there was some network issue.
Yeah, you can say the question once more.
I was saying that in Vata Sanchaya, the symptoms are Sabdapurna Koshtata. So the effect will be same on each and every Prakriti, like Vata Prakriti, Pitta Prakriti, and Kapha Prakriti. So the symptoms, how the symptoms will manifest in each prakriti.
So you are asking whether each person having the the prakriti will be whether it is same or different.
Yes, ma'am. As it is written, Sabdapurna Koshtada, so each
Yeah,
and
yeah.
every person will experience it differently from how and
Not very clear because it was there is a network issue. Anyway, so whatever they have mentioned, for that means it is a the Sabda Purna Koshtata or the Vata Purna Koshtata. So whatever it is, that is in case of a specifically that's what I am told. A Vata Prakriti person's indulgence in the same this intensity what he can experience will be more prominent, but the same symptoms whenever it happens to a other person it may not be to that intensity. Okay, that is what we can understand here. So whenever the Prakriti person having the same problem, the intensity of the disease may be more. But even other persons also can have the same thing, but comparatively the intensity will be reduced than the other one. Okay.
yes, ma'am, got it.
Yeah. Any other question? It was a very good question actually. Okay, thank you.
Ma'am, relation between the Nidana Panchakas and Kriya Kalam.
Yeah, once again, this is related with that. So whenever we call it as the Nidana Panchaka, wherein Nidana Purva Rupa, Rupa Upashaya Samprapti or Samprapti Upashaya, isn't it? So here also same the thing we can slowly we can compare it with, like for example, the Nidana wherein there is a initial stage of the whenever the person starts its the ahara viharas, maybe a mithya ahara vihara, that will be there will be starting of this accumulation of the doshas. So wherein the sanchaya we can tell. Okay. So further there will be continuation of the doshas will be there, so that there will be nidana and but up to purva rupa we have to take this because we have sanchaya prakopa prasara sthana samshraya, isn't it? So here what happens? Nidana, Purva Rupa, Rupa, Samprapti, Upashaya. I mean, sorry, Nidana, Purva Rupa, and in between this the Samprapti will come, wherein the dosha Samochana will be there, and Rupa will come in the next stage. So what happens? The Nidana is the first one, wherein Nidana will be having two parts here. One is Sanchaya and Prakopa. So indulgence in the same Nidana will be leading to the Sanchaya Avastha, as next continuation of the same Nidana leads to the Prakopa Avastha. And still further, this will be leading to the Prasara Avastha, wherein when you enter into the Sthana Samshraya Avastha, that is the Dosha Dusha Samurchana, the exact stage of Samprapti starts here. Okay. Is it clear? Am I audible?
Yes,
Am I
ma'am.
audible? Yeah. So that means here what you have to do is the Nidana, when we tell Nidana will come up to the Sanchaya, Prakopa, Prasara. Okay. So this is the further indulgence of the Nidanas will lead. These three things. The first three stages of Kriya Kala will be still in the dosha stage itself. That is what I was telling you previously also. So only in the so here the doshas will be having its main affliction. Okay, that means dosha vitiation is more here. And next stage is the Nidana Purva Rupa. So when we tell Purva Rupa Avastha is the Sthana Samshraya Avastha, right? So that is the fourth Kriya Kala. So here itself the Samprapti of the disease will start. Okay, that means the dosha Samurchana will start here itself. Okay, so that means the Nidana, for Nidana, there are three things: Samchaya, Prakopa, Prasara. Okay, that means each the Nidana, it's with its continuous usage. Okay, maybe in the form of ahara or vihara. Okay, next is the purva rupa, wherein you can compare with the sthana samshraya avastha. Okay, then comes the rupa. Okay, the rupa avastha, what we can take the other two things, that is the vyakta. Okay, vyakta, and even next comes the Veda avastha. Okay, so Veda avastha, rupa is exactly the vyakta avastha, wherein Veda is the next stage, that is the complicative stage. So the next, so here the important factor is nidana, wherein directly sanchaya will come, purva rupa, wherein directly the dosha sammochana or the sthana samshraya avastha will come. Rupa is the vyakta avastha. Is it clear? That is the relation between the nidana panchaka as well as the. So here in this purva rupa avastha or the sthana samshraya avastha, what happens? There is a samprapti also will comes. Okay, and upashaya anupashaya, because here in this that is directly not related here, but other than that, up to rupa we can take. That is the vyakta and veda. Okay, is it clear?
Yes, ma'am. Thanks.
Okay.
Ma'am, Pratnyaparada, the Sanchaya Prakopa will happen, ma'am, or not?
Definitely it will happen, because in the starting stage itself, in the sanchaya avastha, he was telling, no, I will show you the slide. See, this is the slide, right? Yeah. In this stage, what he tells, for the sanchaya avastha also, chaya avastha, there are two reasons are there. That is swabhavika chaya and aswabhavika chaya. So swabhavika chaya may be because of the natural fluctuation. In that again avastika, daily fluctuation as well as seasonal fluctuation. Okay, swabhavika. Aswabhavika is prajnaparada janya, asatmandriyada sanyoga, or it is like a mityahara vihara. Okay, so that is what, for each and everything, that is aswabhavika also is there. In chayavastha also it is there. That was your question, no?
Symptoms are same or not, ma'am?
The symptoms will be same, no? Symptoms will be, see, any disease, wherever, even if we have Ayurveda, modern, Unani, whatever the disease we tell, every disease will be having the same symptoms, no? So here it may be because of aswabhavika, or it may be because of, it is, maybe you are thinking right, Shaya Puraka as well as Achaya Puraka, or Swabhavika, Aswabhavika. You are telling right.
In the Daiva Vipashraya Chikitsa, ma'am, directly Rupavastha, Chaya Prakopa not seeing, ma'am. Directly Daiva Vipashraya Rupavastha, then only that time we apply the.
Okay. So even Daiva Vyapashraya Chikitsa also, but where we will be using this Daiva Vyapashraya Chikitsa, like mantra, Aushadha Mani Mangala, that only, no? Mantra, Aushadha Mani Mangala. Huh? So
Yes.
those things, when that we will be keeping in the Manasika Vikaras, right? Even to happen a Manasika Vikara, still it is not within 1 day or 2 days it will happen. So it will have its, Sanchaya Avastha, Prakopa Avastha, likewise it will be there. For example, I'll tell you, somebody of daily we will be at our home, right? So your mother, maybe sometimes whenever somebody does some mistakes or something, it will be there in her mind. But she, because some type of anger, or maybe with the servant who is there at home, somehow she will be just adjusting and she will be going, anger will be there in her mind. Okay, and further the servant may do the same thing again, she may just scold her. Okay, oh, that is the next stage, like the prakopa avastha. The next stage again, it is like, no, one day it will be like, no, she can't even hold it, so she will just burst out. So that is the prasaravasa. Suddenly she may kick her from the duty also. So likewise, so that will not happen in a 1 day, isn't it? Even a manasika uh, this one to happen, no? So it will have lot of other this thing. So in such condition, we only this Devi Vyapashraya Chikitsa like mantra, Mani Mangala, etc. will not be helpful. The treatment part is also very, very important. That is why in Manasika Vikara also, they tell the different types of Vamana, Virechana, etc. depending upon the dosha visheshan, depending upon the avastha of the disease. Okay. So usually we will go for a Snehapana. So Snehapana, where it's very clearly he mentions the Sharirika as well as Manasika dosha elimination. So of course, very directly we see the patients also. Right now, we have some of the patients having, manasika vyadhi leading to some of the, it is like a psychosomatic, right? So we need to apply Shodhana therapies. So for that purpose, that is also a Chaya Purvaka, isn't it? Even it is a Manasika Vikara, there will be Sanchita dosha will be there. It will come to the Prakopa, then Prasaravastha, then the Vyaktavastha. Okay. Is it clear or any other?
Yes, ma'am.
Okay.
Thank you, ma'am.
Thank you. You are a PG?
UG student, ma'am.
UG student. Very good. Yeah. Any other question?
Ma'am, shall we wind up the session?
Yeah, yeah. If there is no other questions or doubts,
Yeah,
no?
all the queries are over, I think.
Yeah, yeah. Thank you.
Anyway, it was a wonderful session. Thank you so much, ma'am.
Thank you. I don't know how much I could reach the people, but thank you for the opportunity. Okay.
Thank you, ma'am. Thank you.
Thank you.
भैया किशन भैया
हाँ
एक बार गेट खोलना, भैया को निकलना है, सामान लेना है।
कौन है?
खोलो ना गेट।
कौन है?
उठो।
क्या हुआ?
सामान लेना है, गेट खोलो। सवेरे भैया को जाना है। मोबाइल साइलेंट पे रखते हो क्या? हाँ, वो बड़ा कॉल में थोड़ा सा सवेरे जाना है, सवेरे जाना है। लगन